Good morning, Tim.
Good morning.
Um, what was the condition that you had prior to coming to Dr. Fu's office?
About 10 months ago, I was diagnosed. Well, I first went to an optician. I woke up one morning and I was blind in my right eye. And I went to my optician, or optometrist, I guess, and she sent me to an ophthalmologist. And then the ophthalmologist sent me to a neuro-ophthalmologist. And each of these different steps took time, which became important later. But when the neuro-ophthalmologist saw me, she said I had a condition known as eye stroke. She did a lot of testing on me and found that I had been oxygen starved in the optic nerve, which caused this eye stroke, and it was caused after sleep studies and all sorts of other tests. It was discovered that I had sleep apnea, and I had never taken sleep apnea seriously, had no idea that it could be serious, but at any rate, the sleep apnea is 80% of the time it's caused by sleep apnea, but it does cause permanent blindness, according to her. With that kind of diagnosis, I just wasn't ready to give up. I just was looking for anything that might help, and I read studies that had said that acupuncture had been found helpful with eye stroke. This is also known as NAIAD. But at any rate, I started looking for an acupuncturist. I had never done anything other than Western medicine. So I found Dr. Fu, and he had such a great history and his education, and he's Taiwanese, and I've always been told that Taiwanese doctors are, the schooling there is the best for acupuncture. At any rate, I came here, and that was how I met Dr. Fu and got started with this acupuncture.
Oh wow, sounds like such an ordeal, and must be really frustrating when you couldn't find someone to help you.
It's right, there was just, and I'm an artist, so it was of the utmost importance that I have both eyes to be able to see, as it is for anybody. So at any rate, I came here, and he was trained in Taiwan, which I felt I was very comfortable with that. I liked that idea. Supposedly the best. And when we started this, it was, I think, around 10 months ago. Doctor started in a hole because it had been so much time between the time of the onset of the disease or the condition and the time that he got to treat me. So we started at that point, and he wasn't sure. He was very honest about the thing that he wasn't sure just how far he could take my eye, but he did feel confident that he could bring my eye back to a reasonable level. No, I don't think so. The situation was such that I was desperate. I would try anything, although I was never afraid of acupuncture. I just didn't know about it, and I had never done it. And I thought that acupuncture was just for sore hips or a bad knee or something of that nature, or your back hurt, you could do acupuncture. And I thought that it would help in those conditions. I had no idea that it had been studied and could help other conditions like this eye. I just went to the neuro-ophthalmologist for a 2-month checkup since my last time in there, and my eye is now at 20/30, 20/20 being optimum, and it is now at 20/30 and continues to progress. She said each time she sees me, she said, your eye is better, and I've told her that I'm seeing an acupuncturist, and she was fine with that. She had no studies that said anything about acupuncture in my eye, but she wasn't. She didn't care that I came here. She thought that was, it couldn't hurt anything, and if it helped, fine. So she was open to the idea, I guess is what I'm saying. I would say don't hesitate. everyone here makes you feel so comfortable, from the telephone call when I first called, to being here, to being in the waiting room the first time. There is nothing uncomfortable about acupuncture. And I've never met a doctor that was more caring and more conscientious than Dr. Fu. And I'm not being paid to say this. He just is a great guy and very unique in his profession, to be as kind, as gentle, and there's no pain to it. There's not even a bee sting pain, to tell you the truth. There's nothing to be afraid of or to be concerned. My feeling was, when I started, was that why not? There was nothing that Western medicine was willing to do, and what could it hurt? And so that's why I think anyone should take that particular attitude and try it.